This is 97.7 The Bolt, and it's Tuesday, so it's time for the Humboldt County Memorial Hospital's Your Care, Our Mission show. And this morning I'm joined by Courtney Palmer, and we've been talking about for a couple of weeks. They've got an asthma support group happening at the hospital, so I'll let her talk about all of the things that she's got going on for her.
Sure. So we just want to remind everybody that we're having a monthly asthma support group out at the hospital. And we're going to have our next one next Tuesday, July 26th, in our cardiopulmonary room. So it's really close to the entrance. You just come in the first set of automatic doors and take a right. And you'll see a door back there. And that takes you right into our department. So you don't have to walk very far into the hospital. And we're going to plan for about an hour there. Patients or caregivers, parents, anybody that's kind of affected by somebody that has asthma, or if they have asthma themselves. We just encourage you to come in and listen and learn, share some stories, because people really learn the most when they start speaking to each other. Myself will be there. I'm a respiratory therapist at the hospital, as well as Darla Van Jonigan. And then we also have two nurses that have asthma themselves. So they're very knowledgeable on both ends of that spectrum. It's a free meeting, of course, and it's confidential, very relaxed atmosphere. And we're kind of trying to have a topic every time that we meet, just so that we have some direction and can be prepared with a certain topic of information. So this week we're going to be talking about GERD and how it relates to asthma, because a lot of patients don't realize that symptoms of GERD actually can make your asthma symptoms a little worse as well. And so they kind of work hand in hand. So we're going to do some education on that and just kind of have some open discussion about GERD and how it relates to your asthma. So we just encourage everybody to come out next Tuesday at 4 p.m. At the hospital cardiopulmonary room and join us for about an hour to talk about asthma and get some support from your local hospital.
All right, awesome. We're going to take a quick break here on 97.7 Volt, and we'll be back to talk to Courtney Palmer about many other things that she's got going on at the Humboldt County Memorial Hospital. This is the Your Care, Our Mission show on 97.7 Volt.
The mission of Humboldt County Memorial Hospital is to serve with compassionate care in a patient-centered environment. Humboldt County Memorial Hospital is preparing for the future healthcare environment by working with community physicians and by networking with local and regional healthcare partners. Dr. Vladimir Donchev, general surgeon specializing in laparoscopic gallbladder removal, hernia repair, removal of lesions, just to name a few, right here in Humboldt. What is laparoscopic gallbladder removal? Laparoscopic gallbladder removal is a minimally invasive surgery in which small incisions and specialized tools are used to remove a diseased or infected gallbladder. Please call Humboldt County Memorial Hospital Surgery at 332-7669 for any questions. Humboldt County Memorial Hospital, quality care close to home.
We're back here on 97.7 The Bolt with the Humboldt County Memorial Hospital Your Care, Our Mission show. This week I am joined by Courtney Palmer, and she just talked about the asthma support group. Again, July 26th, 4 p.m. at the hospital. And now she's talking about some tests that you can take, some lung tests, so I'll let her talk about that.
Yeah, I wanted to remind everybody in our community that I do pulmonary function testing out of the hospital. So I am a certified respiratory therapist by the state of Iowa, and I have professional training on how to do these lung function tests. So I've been at the hospital for about 10 years now, and I do well over 100 tests a year. So we can do the math on that. I can officially say I've done at least 1,000 of these breathing tests now. So this is called a PFT. A PFT stands for pulmonary function tests, and they're really just a painless way to measure how well your lungs are working. I usually schedule people for about 60 minutes. Now, you're not going to be doing this breathing test necessarily for 60 minutes, but we allow time for rests and to ask questions. Pulmonary function testing is probably one of my favorite parts of my job, just because I get to really learn about the patient beforehand, find out what brought them in, learn their story, coach them through their test. Many people don't think they can do it, and everybody can with patience and with a lot of hard work. We can get it done. So everybody can do it. The result of the test can help explain shortness of breath, what type of lung problem you have, how smoking may have affected your lungs through the years, whether you're at risk for breathing problems during anesthesia. So I see a lot of patients that are maybe trying to get clearance to have surgery, and their doctor wants to make sure that they're safe to go on that ventilator and come off of it again. And then also just to assess any lung changes over time. Some patients may be on amiodarone or other medications that can affect your lungs in a negative way over time. So the doctor just wants to make sure they're not hurting instead of helping.
Yep.
So, what happens is you come in and do this lung test with me. There's very little preparation. I ask you just to do a few things ahead of time just to make sure that you're in the best health possible before you come in. But you come into my room and I coach you through the test every step of the way. You sit in a chair with a mouthpiece, and you kind of sit in a clear booth. It looks like a phone booth, if anybody remembers what that looks like anymore. But people have compared it to that before. And we take lots of breaks during the test. So we do 4 or 5 different tests. I send you home on your way, and then I put all the results together. I send the results to Dr. Meyer, who is a pulmonologist, a lung specialist, a very well-respected pulmonologist in the area, down at Unity Point Health in Fort Dodge. He reads all of my tests for me and sends them back, and we give them back to your physician. So the turnaround time is very quick. The test is painless. I try to make it as fun as we possibly can.
Yep.
And I just want to remind people that we do that test out here. I know a lot of times, if somebody says, can you get it done in Humboldt, maybe you don't know that for sure. And I just want to encourage people to come on out. I do have a lot of experience in this area. I enjoy what I do very much, and I love to see what patients can accomplish that they don't think that they can. So don't be afraid. A lot of times there's fear of the unknown, which I can completely understand and empathize with. So I just wanted to explain the test a little bit today and kind of ease anybody's fears that maybe has been needing to get this test done for their physician.
All right, awesome. Again, that's Courtney Palmer. And like she said, even with all of the services that they offer, just ask whether or not Humboldt has it. It's worth asking whether or not they actually do it. You guys offer so many different services. I'm surprised every week by the things I learn from you guys, which is great.
Yep.
Again, that is Courtney Palmer here on the Your Care, Our Mission show on 97.7 The Bolt. Don't forget that asthma support group, July 26, 4 p.m. at the Humboldt County Memorial Hospital. Thank you for tuning in, and thank you for joining me, Courtney.
Thanks, Emily.